Hello everyone. Today we will learn about the muscles of the hip. Hip muscles. The hip muscles are also known as the pelvic girdle muscles. They originate primarily from the inner and outer surfaces of the pelvis. They cross the hip joint. They insert onto the proximal part of the femur. Their primary action is to move the hip joint. According to their location and function, they can be divided into anterior and posterior groups. The anterior group consists of three muscles. 1. The iliopsoas, composed of the psoas major and the iliacus. The psoas major originates from the sides and transverse processes of the lumbar vertebral bodies. The iliacus is fan-shaped. It is located lateral to the psoas major. It originates from the iliac fossa. The two muscles unite inferiorly. They pass deep to the inguinal ligament. They insert onto the lesser trochanter of the femur. Between the iliopsoas and the hip joint capsule, there is a large synovial bursa. It often communicates with the hip joint capsule. Therefore, if the hip joint capsule is infected, pus can flow into this bursa. Action: it flexes and laterally rotates the hip joint. When the lower limb is fixed, it can flex the trunk, as in sit-up. 2. The tensor fasciae lati is located on the anterolateral aspect of the upper thigh. It originates from the anterior superior iliac spine. Its muscle belly lies between the two layers of the fascia lata. It descends and becomes continuous with the iliotibial tract. It inserts onto the lateral condyle of the tibia. Action: it tenses the fascia lata and flexes the hip. 2. Posterior group. The posterior group muscles are mainly located in the gluteal region. Hence they are also called gluteal muscles. There are 7 muscles. 1. The gluteus maximus is the most superficial muscle in the gluteal region. It is large and thick. It forms the characteristic prominence of the buttock. It covers the lower part of the gluteus medius and other smaller muscles. It originates from the external surface of the ilium and the dorsal surface of the sacrum. Its fibers run obliquely downward and laterally. It inserts into the iliotibial tract and the gluteal tuberosity of the femur. Action: it extends and laterally rotates the hip joint. When the lower limb is fixed, it can extend the trunk and prevent anterior flexion of the trunk. It is an important muscle for maintaining an upright posture. 2. The gluteus medius. Its anterosuperior part lies subcutaneously. Its postero-inferior part lies deep to the gluteus maximus. 3. The gluteus minimus is located deep to the gluteus medius. Both muscles are fan-shaped. They both originate from the external surface of the ilium. Their fibers converge inferiorly to form short tendons, which insert onto the greater trochanter of the femur. Action: the actions of these two muscles are similar. They abduct the hip joint. The anterior fibers can medially rotate the hip joint. The posterior fibers can laterally rotate the hip joint. 4. The piriformis muscle originates from the anterior surface of the sacrum within the pelvis. Its fibers pass laterally through the greater sciatic foramen to enter the gluteal region. It inserts onto the greater trochanter of the femur. Action: it abducts and laterally rotates the hip joint. 5. The obturator internus muscle. It originates from the internal surface of the obturator membrane and the surrounding bony surfaces. Its muscle bundles converge posteriorly to form a tendon. This tendon exits the pelvis through the lesser sciatic foramen. It then hooks laterally to insert into the trochanteric fossa. There is a small muscle above and below this tendon, called the superior gemellus and inferior gemellus muscles, respectively. They insert together with the obturator internus tendon into the trochanteric fossa, where the obturator internus tendon curves around the ischium, lesser sciatic notch. There is a constant subtendinous bursa of the obturator internus. Action: it laterally rotates the hip joint. 6. The quadratus femoris muscle originates from the ischial tuberosity. It passes laterally to insert onto the intertrochanteric crust. Action. It laterally rotates the hip joint. 7. The obturator externus muscle lies deep to the quadratus femoris. It originates from the external surface of the obturator membrane and the surrounding bony surfaces. It passes posterior to the neck of the femur. It inserts into the trochanteric fossa. Action. It laterally rotates the hip joint. Everyone, in this lesson we have learned about the hip muscles. In the next class, we will begin studying the muscles of the thigh. Thank you.